So hello guys, today we will discuss about the mid-diastolic murmur in very short. Mid-diastolic murmurs. So we can classify them into two categories. One which is occurring due to mitral stenosis and one which is occurring due to aortic regurgitation. Because of the mitral stenosis, we have two types of murmur. One is acute mid-diastolic murmur, another one is chronic mid-diastolic murmur. The acute one, which we known as Carey Combs murmur, and the chronic cause producing the murmur, which we known as the typical or classical murmur of mitral stenosis. Okay, and on the other hand, because of the aortic regurgitation, we have Austin Flint murmur. Okay, so what is happening first? So the patient is having rheumatic fever or suffering from rheumatic fever. Okay, so rheumatic fever is causing acute rheumatic heart disease. We are not going in detail of all these things. Okay, so it may, as we know, that rheumatic fever can cause pancreatitis also. So it may cause acute rheumatic pericarditis, acute rheumatic myocarditis, or acute rheumatic endocarditis. Ultimately, it is the mitral valve which is getting affected. So mitral, whenever there will be acute infections or acute rheumatic fever, it is causing the it is inflaming the mitral valve transiently. Transiently means for a short time. Okay, so mitral valve transiently inflamed. Now what will happen? So since mitral valve is now inflamed, so blood passes through mitral valve, produces what type of sound? It produces soft rumbling murmur. Soft rumbling murmur. But only present in acute stage or acutely. Later it will disappear. Okay, and disappear later. This is known as with what we call as carry comb murmur. So to summarize what is happening, patient is getting affected from the rheumatic fever, acute rheumatic fever, which may cause acute rheumatic pancreatitis, acute rheumatic pericarditis, myocarditis, and endocarditis. Ultimately, what is happening that mitral valve is getting inflamed for a short period of time or transiently. So when blood passes through this inflamed mitral valve, it produces soft rumbling sound, which is present only in the acute stages and later it will disappear. This is known as carry comb murmur. If someone is having recurrent attacks of rheumatic fever, so what will happen? There will be recurrent inflammation of mitral valve. When there will be recurrent inflammation of mitral valve, there will be repeated formation of vegetations, or these repeated inflammation, they heal with fibrosis. Okay, and they heal with fibrosis. So what is happening eventually? They lead to permanent stenosis. And because of this permanent stenosis, there will be permanent narrowing of the valve, and it produces additional sounds, which is or additional sound, or what we call it as murmur, which is known as the classical or typical murmur of mitral stenosis, or classical mitral stenosis murmur, basically, which is causing mitral stenosis and producing the murmur. Okay, because of the rheumatic heart disease or rheumatic fever, we have two type of murmur: acute murmur or chronic murmur. Acute one is known as caricomb murmur, and chronic one is called as classical mitral stenosis murmur. Okay, constant faint murmur. Okay, so what happens mainly in aortic regurgitation, bloodstream from aortic regurgitation, mainly it produces early diastolic murmur. Okay, but sometimes what happens that blood, see, in aortic regurgitation, what is happening that valves are not closing well. Valves are not getting closed properly, so blood used to regurgitate back. So blood from aorta, it regurgitates back or returns back, and it hits the mitral valve, and on hitting it is producing what it is doing, it produce fluttering of the anterior leaflets of mitral valve. Anterior leaflets of mitral valve. Now what happened? Because of this fluttering, what is happening? This fluttering does not allow mitral valve to open normally. Okay, to open normally, and therefore it is producing the functional obstruction of mitral valve. We can say it is producing functional obstruction of mitral valve. So now it is producing functional obstruction of the mitral valve, and so whenever blood from atria has to pass from the narrow mitral valve, so whenever blood from atria has, so now it's good. Blood from atria has to pass through narrow mitral valve, and thereby they are producing murmur, an additional sound producing murmur, which is known as which is known as Austin Flint murmur. So what is happening? Patient is having aortic regurgitation. Because of the aortic regurgitation, blood is returning back, or we can say it is regurgitating back, and it is hitting the mitral valve and producing the fluttering of the anterior leaflet of the mitral valve, and does not allow mitral valve to open normally, and it is causing the functional obstruction of the mitral valve. So blood from the atria has to pass from the narrow mitral valve, and thereby it is producing a murmur which is known as Austin Flint murmur. So this is about the mid-diastolic murmurs.